Hey, how you doing? Oh, can you hear me?
I can hear you. Can you hear me?
Okay. Okay, cool. It's been 5 minutes, as the kids would say. No, the kids don't even say that anymore, actually. I don't think they ever did. But anyways, thanks for joining me again.
Thanks for having me
So,
again, Khaled.
yeah, how you been?
Good, just fighting the fourth wave.
Yes. A lot of questions because I haven't had you in a while. So, let me ask you about, do you think there'll be any more lockdowns coming up in the fall?
We're in a very different position now than we were last summer, right? Because this virus is a lot less novel to the 1 million or so residents who've now gotten 2 doses of vaccine. So the hope is, of course, that we can continue to get more and more people vaccinated and protected, and also continue just for a little while longer while we still have a lot of people unvaccinated to, limit our contacts, try to avoid, keep the powder a bit dry, keep gathering small outdoors, that sort of thing. And hopefully we'll get through this, in pretty short order. But we're in a really good position now, so I'm hopeful that we wouldn't necessarily need to move to broad community closures again.
Okay. If the fourth wave does get worse, do you see Peel Public Health closing down schools like they did last time?
Well, I think schools, even in the third wave, those were really like the last things to close, right? At that point, we had already had, personal service settings, restaurants, gyms were already closed. There were all sorts of other places that had closed. And then at the point where we were really seeing the third wave start to get out of control, that was where we had to move schools back virtually. The aim is always to try to keep kids in school. There's no question that they benefit from learning in person. And so the aim will be, of course, to continue to keep kids in school, and that really means that all of us need to do our part, making sure that we're getting vaxxed, and also making sure that we're limiting our contacts and sticking to precautions, distancing, masking, all the good stuff.
Okay. I know you have the Section 22 in your back pocket just in case things get out of hand. But would you use the Section 22 order again to shut down warehouses and factories like you did in the third wave?
I mean, it depends on what we're seeing, right? And I'm not going to rule out using a Section 22 if we're seeing a significant exposure or outbreak or whatever the case might be. We obviously want to continue working with our provincial partners. That's obviously first and foremost in the priority. But I think the Chief Medical Officer of Health has said that he foresees, especially because it's really just pockets where clusters can form within unvaccinated people at this point in time, that there may need to be more local action taken. Nothing I'm contemplating at this point in time, but I think given that's the way the province is approaching things, we'll always keep on track, obviously.
Awesome. The new vaccine certificate, or vaccine, I guess they call it the vaccine certificate, is being implemented by September 22nd. Do you see the Peel Public Health kind of enforcing it stricter guidelines like in malls and stuff like that?
Well, I think the first thing that everyone should be doing is ensuring that they have their 2 doses of vaccine. That's the best way to prevent severe illness and also reduce the risk of infection and passing it on to someone else. But when it comes to vaccine certificates, that actually is really helpful because it actually protects people who are still susceptible, who may not have received 2 doses of vaccine yet, in settings where you can't maintain precautions regularly. So things like masking, distancing, and you're in close contact or in crowds. That's the purpose behind this. It's a temporary measure that's meant to essentially be here while we still have a large number of people that are that remain susceptible. But I think in terms of it, like anything that comes in, obviously there will be an educational period first, really just sort of working, and then once it becomes much more commonplace and the protocols are understood, then we would work with our other enforcement partners to see about more strict enforcement around the measure.
Cool. I guess who will be enforcing this? Because I know, we see these anti-vaxxers, protesting in hospitals and stuff. You know they're going to cause a problem when it comes to this. Who do you see enforcing this?
Well, as always, we work very closely with bylaw enforcement and also our police partners, and I believe it's being made that anyone who's a provincial offences officer can enforce it. But certainly, if needed, we would work with any of those partners to ensure that it is enforced in an appropriate moment. I think it's a good opportunity, though, for me to just sort of remind people, especially for people who are protesting outside hospitals, anti-vaxxers. The reality is everyone who's on, in those hospitals and everyone who works in public health, myself included, like we want this to be over too. Like, don't get me wrong. And I think it's a little heartbreaking, frankly, that we're not, I think people are sort of losing the forest for the trees here. The best way for us to get through this is to work together to make sure we're all getting protected. And then at some point, this disease ceases to be novel when most people have been either infected or been immunized.
Have you seen the vaccination progress slow down in Peel?
I mean, we're still vaccinating approximately 15 to 20,000 doses a week. This is, of course, not as fast as we were at the height of our capacity. But what is really good is even those 15 or 20,000 doses, those are getting first doses to people who have, for whatever reason, haven't had the opportunity to get vaccinated yet. So some of our most vulnerable people with access challenges. It's also people who had lots of questions that just needed a little more time to understand, to have their concerns addressed, so that they could get their shot. So even though it is a smaller number in terms of quantity, there are really big gains in terms of who's actually taking the vaccine at this point in time.
Okay. I know the Vax van is coming into Peel, right? And I know Peel Public Health knows where the pockets are of kind of lower vaccination rates. Are you going to the communities, the apartments, the workplace settings with this Vax van?
So honestly, workplace settings, because we did that in the first rollout, like we've managed to get many of them. Our focus really is on the community at this point in time, particularly educational settings. We do know that kids 12 to 17 in particular, who are back in school, they're still eligible for the vaccine, and we still have pockets there. So we have dozens of clinics that are planned, in community settings, getting these closer to home so that people can access them in places that they're more comfortable and maybe willing to get questions answered. So, for example, we've got about 60 different school clinics that are set up throughout the month of September and into October. We've got clinics that are going to bus terminals, grocery stores, more familiar places, really trying to get as close as possible to people so they have the opportunity to access their shot more easily.
So you're saying that like a Square One bus terminal will have the Vax van there type
Well,
thing?
it's entirely possible. Yeah, we're heading to places where people are passing through, just making it as easy as possible for people.
Awesome, cool. What's the situation like at the Peel hospitals?
So in terms of our Peel hospitals, like you have to remember, they're actually trying to clear a very significant backlog right now. A lot of surgeries and whatnot got postponed in the previous waves, so they're super busy trying to catch up on that. And at the same time, we are starting to see hospitalizations tick up somewhat. We had 41 hospitalizations in the last week. We've got 33 hospitalizations the week before. So you're seeing these COVID-related hospitalizations increasing, but they're not increasing as fast as they used to, which really shows me two things. First of all, that the vaccines are working, and second of all, that people are really sticking to the precautions and doing their part. I'm hoping that we'll be able to keep it going and getting out of here.
Nice. And I gotta get your opinion on the protests in the hospitals and stuff like that. What are your thoughts on that?
I think one of the things that I've said throughout the pandemic is it's really important to try to put yourself in other people's shoes. And we know that everyone has had a difficult time. Everyone's frustrated. Nobody wants to be living through this pandemic. The two things I would say is for our healthcare providers that are on the front lines, who've been seeing people die of this disease, who've been seeing people suffering with this disease, unable to breathe, this is an added stress, I think, on these people that have sacrificed so much to keep people safe and to save lives that they really don't need. And then I think for the patients that are showing up there, I would ask everyone to think about it. If it was your family, if your loved one needed emergent surgery, if your loved one was having a heart attack and they had to fight their way through crowds of protesters, like how would you feel, right? So I
Yeah,
think it's about just realizing that we're all in this together, as cliched as that's always been. Ultimately, we all want the same thing. We all want this to be over, and we only really get there by working together.
true. And the toughest question for you, Dr. Lowe, is are you taking any time off ever?
I got to take some time off this summer, which was actually really good,
Okay.
and managed to get some rest, eat some good
Okay.
food, spend some time with family. So I encourage everyone to do that,
Okay.
where they can.
Awesome. Okay. That's all the questions I have. Thanks, Dr. Lowe.
Thanks so much for having me.
Later.